This is Takoa Rogers, FMP student at Albany State University, and today I'll be performing a knee assessment. The assessment starts by asking the patient to walk around in the room. We did that initially, and in walking around, I observed for any disturbances in the patient's gait, any issues with weight bearing status. Looked at the knees to see if there was any swelling. Also, look for symmetry as well as any scars that may indicate surgeries or injuries to the knees. And also, as the patient was walking, I looked at the popliteal area as well for any swelling in that area. And we start this assessment here by asking the patient if he has any pain in the knees. Do you have any pain? The patient replies, no, there's no pain or issues with the knees. And then we'll start with our palpation. I'm going to come around and get a little closer. We start with palpating, and we actually feel both of the knees. And when we're doing this, we feel with the back of the hand. And the purpose is to check the temperature. You want to feel the temperature of the skin. And if there's any extreme warmth there, that's an indication that there's a sign of inflammation in the area. And you would do that with both. Of course, with both knees. And then we can check our patella. We do a patella tap, and here we're pushing up on the knee, and we press, pushing the fluid up, and we press in on the patella there. And also with our swipe test, we can perform that while the patient is laying with the leg flat. With the swipe test, you're going to do a swiping motion, and what this does is maneuvers the fluid in the knee there, and there you're checking that would give you an indication if the patient has a possible effusion or pockets of fluid there. You would see wrinkling or bulging in the knee with the swipe test. And then we can palpate the knee with the leg straight, checking the quads, the quadriceps tendon here. We can check the patella tendon. We can also check fibula here. And we would do the same on the opposite leg. And then we would ask the patient to flex the knee. We want to do that at a 90-degree angle, and then we'll palpate further. Can you bend your knee for me? Bend that knee up. Very good. And again, we can check the patella tendon, the tibial tuberosity, the medial joint lines, and also the head of the fibula as well can be palpated in this position. And we can also assess the popliteal fossa here. Straighten that leg and bend the other, and we will perform the same on the opposite knee. Okay, and then we check the active flexion and extension of the knee. Can you bend your knee for me? Bend it as high as possible. There we go. And then straighten it back out. And then do the same with the opposite. Okay, straighten it out. And then we can check passive flexion and extension as well. I'm going to bend your knee for you, okay? And do the other. And then we can do our passive knee hyperextension, where we want to just kind of bend the knee and extend the foot inward bend. So, all right. Then we're going to bend the knee here just about at a 30 degree angle. I'm going to hold here. This is called a Lachman's test. And what we're doing is bending at a 30 degree angle. We hold the femur still and we're actually moving the tibia. There. Very good. Thank you very much. And this will conclude our knee assessment.